So I don't do that type of massage anymore because I feel that it is unsafe. And the alternative to deep tissue that I do, which is a lot more effective, and it gets to the root of the problem. Deep tissue just addresses the surface of the knot or the surface level of whatever issue you're having. It does nothing to address the root cause of the issue. Okay, so if you have some, discomfort or pain, inflammation, if you have knots, or if you just have a sore back or whatever, myofascial release is probably like the best method that I have come across to relieve tension, to relieve knots, pain from knots, and all that stuff. It softens the knots and it reduces the tension that you're having in your body drastically. And what it does is it gets to the root cause of the problem. It doesn't just work on top of the muscle like deep tissue does. It works beneath the muscle, okay? And a lot of our restrictions are not just in the muscle itself. A lot of our restrictions are beneath the muscle where the fascia is. And the fascia is a connective tissue that's all tangled up and jammed up, right? And so when that happens, knots develop, right? So what myofascial release does is it gets to the root of the problem underneath the knot and surrounding the knot, okay? Our fascia is throughout our whole body and it holds our muscles together. So most of the restrictions that you are feeling when you have knots and all that kind of stuff is from the fascia itself. So that's why myofascial therapy works better than deep tissue. It relieves pain for a lot longer than deep tissue, and it relieves discomfort for a lot longer. On average, most of my patients who come back and report back to me how they feel after a myotherapy session say that the pain relief lasted for about 4 weeks. So with deep tissue, the pain relief might be a little less than that. It could be like right when you get off the table, the pain might come back, okay? Or maybe it'll last a week or two if you're lucky. So with myofascial release, you do not constantly have to get myofascial release because each session that you have of myofascial release, the sessions build on each other, and they build on each other to the point where your inflammation is going to go down and your restrictions in your muscles is going to go down. You're going to have more mobility. So therefore, you would need fewer sessions of myofascial release in the future. Unlike deep tissue, where you're going to be constantly on a hamster wheel, chasing that pain, chasing that pain, chasing that pain, with no end in sight. With myofascial release, the restrictions are minimized, and the restrictions are going to be less and less with the more sessions that you have. And that's a proven fact, and you can look it up online if you wanted to, learn some more information about that. But I'm an advocate of myofascial release. Deep tissue is not worth the pain, because if you have a knot and you got a therapist using their elbow, sticking the knot with their elbow, with their pointed elbow, it hurts. It hurts really bad. And so you're putting more inflammation on that knot, right? So your knot is already inflamed. That's why it's a knot. And then you get the deep tissue. So the therapist is applying more pressure, making that knot more inflamed. And then not only do you have to recover from the inflammation from the deep tissue, then you have to actually recover from the knot itself, causing pain and problems. With myofascial release, you don't have to worry about any of that. And so I also work with physical therapists physical therapists, they use a lot of myofascial release. They use it a lot, and I have talked to them, and we all have come to a conclusion that it's a way better method of reducing knots, inflammation, and tension in the body. Myofascial release can be done anywhere in the body. It could be done in the legs. It could be done on the neck. It could be done on the back if you have knots on your back, knots on your legs. You can even have knots in your hamstrings or your quads. So yeah, it's highly effective. And I really hope that for those of you who are stuck on deep tissue, you get out of the mindset that it has to hurt in order for it to be effective, because that is really, really, really not true at all. So yeah, I just came on here to give y'all some information, and I hope you guys have a great day. If you want to book a session, you can go and click the link in my bio, and I will be happy to do an assessment for you and to do myofascial release so that you can see the difference. Okay, thanks and have a great day.